So, a pleasant day, dear doctors, and welcome to our session. This morning, this is actually a convergence of three subjects, three major references, which would cover pathology, pediatrics, as well as surgery. And we will discuss briefly on the pediatric cancers. So, this is Dr. Toom. Pleasant good morning to everyone. Now, I would like to start off by having a quick poll. So may I request everyone to scan the QR code, which is flashed right in front of you. So we're going to have a pre-course reflection and survey. This is going to be very quick. So please scan this QR code here at the lower left corner of the screen and log in. So I hope you've logged in already. So scan this QR code to access my Mentimeter account. Okay, so let's begin. Okay, half have logged in already. How about the others? Okay. Now, the first reflection or question. Okay. First question. So this is our survey. What pops into your mind when you hear Wilms tumor? Okay, some people answered bone, pediatric, neuroblastoma, bata, kidney, kidney cyst, pediatric tumor, pediatric patient. Okay, good keywords. Pediatric kidney cancer, abdominal growth, nephroblastoma. Oh, pedia most common. Pediatric kidney neoplasm, most common pediatric nephrosolid tumor. Okay, that's a perfect keyword. Young population. Okay, Wagger, very good. I'm impressed. Spindle shaped. Okay, nephroblastoma, midline. Okay, great. These are great. Okay. So thanks for submitting your responses. Let us now proceed to the session proper. So good day again, dear doctors, and welcome to our module on the pediatric cancers. Now, what I want everyone to take note is that this module is actually a module which will utilize three very important references. It's a convergence of three subjects: pathology, pediatrics, as well as surgery. And these are the three references which I use for this presentation: Nelson's Textbook of Pediatrics, Swart's Principles of Surgery, and Robinson-Coatran pathologic basis of disease. I'm going to begin with this image, okay, about the embryology of the nervous system, wherein we have very important structures like the neural fold, the neural groove, and the neural crest. Now, I'm showing you this image because I want you to put in your heads this phrase, the neural crest. Why? The neural crest is actually where the cells that cause neuroblastoma arise from. So neuroblastoma actually arises from the neural crest cells. It is considered to be the most common extracranial solid tumor in children. Okay, the most common extracranial solid tumor in children. And it's considered to be the most commonly diagnosed malignancy in infants. Now, as a general rule in pediatrics, what is the most common malignancy in children? What is the most common malignancy in children? Okay. What is the most common malignancy in children? Okay. What is the most common malignancy in children? Okay. The most common is going to be leukemia. Okay. So the most common is going to be leukemia. And the most common leukemia is going to be ALL, or acute lymphoblastic leukemia. ALL, or acute lymphoblastic leukemia, is the most common cancer or malignancy in children. Okay, so I hope everyone got that. Now, going back to the neuroblastoma, this is why I showed you that figure of the neural crest cells. Because the neural crest cells, okay, this is actually lifted verbatim from clinically oriented anatomy by Moore. These are the 6 structures which actually differentiate from the neural crest cells: the posterior root ganglia, the sensory ganglia, the autonomic ganglia, the Schwann cells, and the cells of the suprarenal medulla and the melanocytes. Now, out of the cells you see here that differentiate from the neural crest, which one gives rise to the neuroblastoma? Which one gives rise to the neuroblastoma? Okay, which one of these cells here is the one that gives rise to the tumor, the neuroblastoma? Okay, it's the cells of the suprarenal medulla, okay, the adrenal medulla. That is what gives rise to the neuroblastoma. Now, the neuroblastoma, okay, are derived from the neural crest cells. Okay, that is very, very important. Now, it is stated that there's a mutation in 2 major genes, and these mutations of either of these 2 genes is associated with neuroblastoma. First, we have the ALK gene, or the ALK gene, and we have the FOX2B gene, or the PHOX2B gene. These are the 2 gene mutations which are associated with neuroblastoma. Okay, so again, where does a neuroblastoma arise from? It arises from the neural crest cells. And from the neural crest cells, they can develop into the suprarenal medulla cells. And that's where it comes from. Now, according to the American Childhood Cancer Organization, these are the common symptoms of neuroblastoma. So, layman's terms, there's a lump in the abdomen, there's abdominal mass, there can be a lump in the chest, there can be bone pain, and bruising around the eyes. Now, what do we call clinically the bruising around the eyes? What do we call this? How do we report this in the physical exam? How do we report this in the physical exam? Okay, very good. Okay, there's the periorbital ecchymosis. Some people call it what? It's named after an animal. Okay, the periorbital. Okay, very good. The raccoon eyes. Okay, looks like several of you when you're from duty, when you had a toxic duty in the ER, in the labor room. Okay, the raccoon eyes usually comes natural for interns. So a lump in the abdomen, a lump in the chest, bone pain, and bruising around the eyes. Now, the most common presentation, since we're preparing for exams, of all of the manifestations I mentioned earlier, the most common is abdominal pain. Okay, abdominal pain is the most common. And when there is a mass, okay, it's either in the abdomen or the flank. Number one, it's palpable. Number two, it's non-tender. Okay, it's hard and it is smooth. Okay, so please take note of this again. Palpable, non-tender, okay, hard, smooth. So take note of these manifestations. Now, about 45% of neuroblastomas arise from the adrenals, okay, particularly the adrenal medulla. 1/4 or 25% will be found in the retro, okay, peritoneal sympathetic ganglia. Now, question. If we say adrenal medulla, okay, and it is a child, the most common tumor of the adrenal medulla in the child is still a neuroblastoma. What if it's an adult? What is the most common adrenal medulla tumor in the adult? Okay. So in the adult, what we would encounter is the famous pheochromocytoma. Okay, in children, it's neuroblastoma. In the adult, it's a pheochromocytoma. Now, what are the most common extraadrenal source of a pheochromocytoma? What do we call these cells or ganglia? The most common extraadrenal source of pheochromocytoma. Again, the most common extraadrenal source of pheochromocytoma. We call this the organs of Zucker-Kandel. You usually see this along the sympathetic ganglia. In the organs of Zucker-Kandel. Okay? Please take note of this. Okay, the organs of Zucker-Kandel. So I hope this is clear. I hope this is clear. So aside from the adrenal glands, the sympathetic ganglia, okay, we can see them in the paravertebral ganglia of the chest and the back, and of course, the organs of Zucker-Kandel. That's for pheochromocytoma. Now, I just want to highlight this regarding the primary development locations. Neuroblastoma commonly develops from the adrenals. Okay. It can also be found in the spine, particularly the nerve roots. Okay. So stage 1 of neuroblastoma, the primary development locations. Number 1 is the adrenal gland. Number 2 is the spinal or nerve root. The adrenal gland. Then we have spinal, okay, or nerve root. Okay, so please take note of this. Now, how does neuroblastoma usually present? Number 1, if there's the presence of a neck or an apical lung mass, since there's compression of the sympathetic chain, there can be Horner syndrome. There can also be paraneoplastic syndromes, okay, profuse sweating, secretory diarrhea, and the most common is what we call the opsomyoclonus, or the dancing eyes, dancing feet syndrome. Now, can anyone here tell me what are the 3 components of Horner syndrome? What is the triad of Horner's syndrome? Okay, meiosis is correct. Okay, what else? We have anhidrosis. Okay, then we have ptosis. Okay, meiosis, anhidrosis, then we have ptosis. Meiosis, anhidrosis, then we have ptosis. Okay, meiosis, anhidrosis, then we have ptosis. Meiosis, anhidrosis, and ptosis. That is Horner's syndrome. Now, I want to zoom into the opsoclonus myoclonus because this is what came out in the pediatrics exam. Okay, so I want everyone to remember dancing eyes, dancing feet syndrome. This is also known as opsoclonus myoclonus. And this is seen in what tumor? This is seen in neuroblastoma. Okay, dancing eyes, dancing feet syndrome. That's opsoclonus myoclonus. Okay, dancing eyes, dancing feet syndrome. Opsoclonus myoclonus. Okay. Now let me add some supplements here. This is what we call the opsoclonus myoclonus ataxia syndrome, also known as OMA, OMA, opsoclonus myoclonus ataxia syndrome. So they usually have uncontrolled, rapid, okay, jerky movement of the eyes, the trunk, the limbs. There is also cognitive decline or cognitive dysfunction. There's also poor coordination. Okay, so this is the opsoclonus myoclonus ataxia syndrome. Now, I want everyone to look at this. Okay, I want you to pay attention to the eyes. So if you see a child with eyes like that, okay, let's play it one more time. Always have neuroblastoma in mind. Now here, got this from the net. Okay, opsoclonus myoclonus ataxia syndrome in a child with subacute sclerosing panencephalitis, or what we commonly call SSPE. Question: what's the most common virus associated with SSPE? What is the most common virus associated with SSPE? Okay, it is measles virus. Okay, measles virus is the most common virus associated with SSPE. So here, look at this video. Look at the eyes. I hope this sticks in your head. It's very classic of opsoclonus myoclonus. Okay. Now, neuroblastoma is notorious for metastasizing to multiple organs, particularly the liver and the bone. It can metastasize to the lymph nodes. It can metastasize to the bone marrow. Now, once there's periorbital ecchymosis, or the raccoon sign that we mentioned earlier, that means there's already involvement of the orbital bone. There's metastasis to the bone already. Now, metastatic disease can present with irritability, febrile episodes, cytopenia, proptosis, and the bluish subcutaneous nodules or the rash. Can anyone tell me what is the description of the rash of neuroblastoma? These bluish nodules, what do we call this rash? Okay, again, what do we call this rash? Bluish subcutaneous nodules. Okay, we call this the famous blueberry muffin rash. Now, here is the classic blueberry muffin rash of neuroblastoma. Now, what infectious neonatal syndrome also presents with a blueberry muffin rash? Okay, very good. It is congenital rubella syndrome. Okay, congenital rubella syndrome. Now here, the ecchymosis, look at that, the raccoon eyes. What is the significance again if there is the raccoon eyes or the periorbital ecchymosis? What is the significance if there's periorbital ecchymosis? It means there is already metastasis to the orbital bone. So this is already a disseminated neuroblastoma. Now here, periorbital metastasis of a neuroblastoma with ecchymosis and proptosis. So this is lifted from Nelson's. So neuroblastoma can present as the blueberry muffin spots. Okay. You see them in the skin, and you have here the periorbital ecchymosis. We have said a handful of keywords already. Okay, a handful of keywords for neuroblastoma. Okay, raccoon eyes, blueberry muffin. Okay, so here it is again. Now, for the diagnostics, always remember, we look for metabolites of catecholamine metabolism. What is the meaning of VMA? It's not Video Music Awards. What is the meaning of VMA? What is the meaning of VMA? VMA stands for vanillic mandelic acid. HVA is homovanillic acid. Okay, so please take note of this. So VMA. This is the same urinary metabolite for pheochromocytoma, VMA. Okay, same metabolite for pheochromocytoma. Now, MRI is required as well as a biopsy. Okay, MRI is required as well as a biopsy. Treatment, of course, is surgery and chemotherapy. Now, question: what is the characteristic microscopic finding of neuroblastoma? What is the pathology per or the buzzword? Neuroblastoma. What will the pathologists consider as the pathognomonic microscopic finding? Okay, this is the famous Homer Wright rosettes. Actually, it's Homer Wright pseudo rosettes. Okay, if you want to be strict in the book. Okay, take note, Homer Wright pseudo rosettes are seen in both neuroblastoma and medulloblastoma. Now, there's an old term in pathology, which is not used that much anymore, where in neuroblastoma, medulloblastoma, they were previously classified as what we call PNET. Can anyone tell me what PNET means? What does PNET mean? It means primitive neuroectodermal tumor. A primitive neuroectodermal tumor. Okay, please take note of that. PNET. Okay. Now, I want you to remember they call it pseudo rosettes from a pathologist's point of view because it does not have a true lumen. There's another pediatric cancer known as retinoblastoma. What rosettes do you see in retinoblastoma? Okay, what rosettes do you see in retinoblastoma? Okay, what rosettes do you see in retinoblastoma? In retinoblastoma, very good. We have the Flexner-Wintersteiner rosettes. The true rosettes is the Flexner-Wintersteiner, which you see in retinoblastoma. Homer Wright are pseudo-rosettes. Why are they called pseudo-rosettes again? What is the pathologist's explanation why they call it pseudo-rosettes? Okay, because it has no true lumen. But they basically look the same. Okay, so please remember that. Now, tip. We have the true ependymal rosettes. That means there's the presence of a lumen, which is usually empty. Okay, and we have short cytoplasmic processes. This is what you see in Flexner-Wintersteiner rosettes. This is retinoblastoma. In Homer Wright rosettes, you're going to see a central lumen with the presence of cells as well as neutrophils. So that is the major difference. Okay. Now I need to share this with you. This one came out in the boards. It's actually lifted from this table in Nelson's regarding the international staging system for neuroblastoma. Now, what I want everyone to remember is what is the 4S stage or stage 4S. So what is this stage 4S? Okay, So I want everyone to remember stage 4S of neuroblastoma is a unique category of neuroblastoma. You see this in infants who are less than 1 year old. And take note, it has a small primary tumor with metastasis, but it is limited. Take note, the key word is limited to the skin, the liver, or the bone marrow. So why is 4S so good? It has a favorable outcome, even if it has reached other sites because of metastasis. So let's make sure everyone catches this. What is the stage of neuroblastoma that exhibits metastasis but has a favorable outcome? What stage is it again of neuroblastoma? It has limited metastasis, but it has a favorable outcome. Because the dictum in oncology is once there's metastasis, it means it's advanced. The more advanced a carcinoma is, generally the outcome is not very favorable. So this is the 4S. Okay. That is the significance of that. In fairness to the board examiners, it really makes sense why they asked this. Now, for the laboratory studies, in addition to the VMA, okay, and the HVA, usually, okay, take note, 90% of neuroblastomas will produce catecholamines. So that's VMA and HVA. Okay, so please take note of this. So when you do a scan, okay, the mass is going to have calcifications. So this is very classic. Okay. Now, next is the Wilms tumor. Now, just a rough idea. Do you think neuroblastoma and Wilms tumor will come out in an exam, particularly the board exam? You think it's going to come out? It's a capital yes. Okay. It will obviously pop out. Okay. Now, let's focus on Wilms tumor. This is considered to arise from the metanephric blastema, which is the origin of the kidneys. Okay. It is the precursor of a normal kidney. So if we mention two gene mutations are associated with neuroblastoma, Wilms tumor is associated with the WT1 gene, which basically stands for Wilms tumor 1 gene. Okay, so this affects chromosome 11. So please take note of this. Now here's a photo of a Wilms tumor. This is nephroblastoma, so this is in children. Now, always remember if it ends in the suffix blastoma or blast, is this children or adults? If it ends in blastoma, it would favor children, okay, or pediatrics. So what is the most common pediatric renal tumor? The answer is Wilms. What about in adults? What is the most common primary kidney tumor in adults? Okay, very good. It is renal cell CA, particularly clear cell. Okay, if they go details as to the subtype of renal cell. So renal cell CA in adults, and the most common subtype or histologic type of renal cell CA is going to be clear cell. Now, this one came out in the pathology boards. Actually, it was grammatically wrong because they asked what tumor has a triphasic blastema. It is triphasic in appearance. The blastema is already part of that triphasic component. So theoretically, it's grammatically wrong to use this term triphasic blastema because the blastema is one of the three features. So what is this triphasic? Okay. We have blastema, stroma, and the epithelial cells. So blastema, stroma, and the epithelial cells. So please remember this. This is the triphasic pattern or description. So here, the triphasic tumor, the Wilms tumor or the nephroblastoma, has a blastemal component. These are the small blue round cells. A small blue round cells. You have the epithelial component, and you have the mesenchymal component. Please memorize that. Now, Wilms tumor, as I mentioned earlier, is the most common malignancy of the kidneys in children. Mean age, take note of the age. It's 3 to 3.5 years old. Quite young. Okay, it's quite young. So 3 years old. I usually tell myself that the kidney looks like a number 3. Okay, the shape of the kidney looks like a number 3. Now, the signs and symptoms of a nephroblastoma. Primary sign, it's painless. Memorize the word painless. Okay. There's an abdominal mass that crosses the midline. Okay. Painless, and it crosses the midline. It has variable symptoms from vomiting to abdominal pain to hypertension as well as hematuria. Now, the bone pain is characteristic, as well as there are also the presence of bluish nodules. Okay. Now, this was mentioned earlier, WAGR, which stands for Wilms tumor, aniridia, genitourinary malformations, and mental retardation. Sometimes the Wilms tumor is part of a syndrome, and that syndrome is known as WAGR. Okay, so the WAGR, Wilms tumor, aniridia, genitourinary symptoms. Then we have the mental retardation. So take note of this. Wagger. Diagnosis, okay, X-ray, CAT scan, biopsy. Treatment is also triple, surgery, chemotherapy, as well as radiation. Now, compared to adult primary renal cancer, nephroblastoma carries a better prognosis. Okay, it carries a better prognosis. Now, I want to mention this syndrome, okay, Beckwith-Wiedemann syndrome, commonly known as BWS, Beckwith-Wiedemann syndrome. They usually present with abdominal wall defects, such as an omphalocele and an umbilical hernia. They have a characteristic macroglossia. Now, tip, if you see an infant with macroglossia, you need to make sure it is not congenital hypothyroidism, okay? And when it's severe, we call that cretinism. Now, what is the difference between gastroschisis and an omphalocele? What is the major difference between an omphalocele and the gastroschisis? Okay, very good. You have the presence of a sac or a covering. An omphalocele has the presence of the sac. Okay. Now, what is the significance of BWS? It's actually associated with two childhood tumors. Number one is Wilms tumor. Second is Ewing's. So it's associated with Wilms tumor as well as Ewing's. Now here, this is the macroglossia. Look at that. Okay, we get the macroglossia. What is your differential again? What are the two conditions you should think of if you encounter an infant with a large tongue? Okay, very good. Congenital hypothyroidism. Congenital hypothyroidism. Then we have congenital hypothyroidism or cretinism. Then, of course, we have Beckwith-Wiedemann. BWS. Okay. Now here, of the manifestations for nephroblastoma, I would stick with these five. Okay, because I mentioned earlier, variable. At times, the manifestations might be similar to retinoblastoma, okay, or neuroblastoma, okay. So here, take note, hypertension, hematuria, fever, abdominal pain, and an abdominal mass. Is the hematuria painless or painful? What is the classic hematuria? Painless or painful in nephroblastoma? Okay, it is classically painless. Okay, it is classically painless. That's very, very important for you to remember. Okay, now next tumor, retinoblastoma. Most common intraocular tumor in children. Median age is 2 years. Now, again, for you to memorize. How old again is nephroblastoma? Look, I'm drawing a kidney. How old again? Okay, it's usually 3 years old. Now, everyone, look at this. I'm going to demonstrate something to you. Okay. I'm drawing the eyes. Okay. So always remember, if there's retinoblastoma, yeah, and it's the most common intraocular tumor. So how many eyes are there? How many eyes are there? There are two. Therefore, how old yung retinoblastoma? It's 2 years old. That's just how I personally memorize it. Huh? Yeah, that's a good one. Retinoblastoma. That's a good one. Okay. So very, very important for you to know these things. Okay. Now, the gene is the RB1 gene. Now, summarize. We mentioned neuroblastoma. We mentioned Wilms tumor. And now we mentioned retinoblastoma. What is the gene for neuroblastoma? What are the two genes? What are the two genes mutated in neuroblastoma? Okay, what are the two genes? Okay, one is the ALK, very good. The other is the FOX2B. Okay, what about Wilms? What's the gene? Okay, it's the WT1 gene. What about retinoblastoma? Okay, it's the RB1 gene. Group them together. Okay, and what is that syndrome again, which is associated with both Wilms, Ewing's? Okay, what is that syndrome? Wilms and Ewing's, and it presents with a large tongue. What is that? Okay, that's Beckwith-Weidemann, a large tongue. Okay, you now try applying it. Okay, please take note of that. Now, retinoblastoma, what are the eye signs? You would expect the famous, okay, leukocoria, also known as the cat's eye. Something also very important, which I learned because of a recent board exam, is strabismus. What is strabismus in retinoblastoma? Is it an early sign or is it a late sign? Strabismus. Is it an early sign or is it a late sign? Okay, strabismus is an early sign in retinoblastoma. Okay, so here, I hope this sticks in your head and you will never forget this. Now, I need to highlight this. This is the chapter, screenshot from Nelson's. Dami kasi nagreklamo dito. What is the initial presentation now? Or the initial presenting complaint? Almost everyone answered leukocoria. The answer is strabismus. Strabismus is often an initial presenting complaint. Okay? Leukocoria, usually you see this or you notice this when there's flash photography. Biglang there's a reflection on the eye. And this is actually caused by the absence of the red reflex. So leukocoria medically is also known as the white pupillary reflex. Okay, the white pupillary reflex. So here, lifted from Nelson's, look at that. The white pupillary reflex. You see it here on the left eye. So here, known also as the cat's eye. And here's the strabismus I mentioned to you. So what are the usual early manifestations? The initial complaint is often strabismus. Next, we have decreased vision, inflammation of the orbits, you have the presence of a hyphema, and irregularities of the pupil. So please take note of this, okay? So please take note of this. So do you remember the Rosettes again? What we call the Rosettes pathology of retinoblastoma? Okay. We call them the Flexner-Wintersteiner Rosettes. And as mentioned earlier, it has a well-defined lumen, unlike the Homer-Wright pseudo-rosettes of neuroblastoma. Okay. Now let's quickly summarize the leukemias. So we have ALL, which is the most common, AML, okay, which is next. Then we have the CML. Now, always remember, ALL is associated with Epstein-Barr virus. This is also associated with Alzheimer's disease. Okay. Now, AML has the presence of the myeloperoxidase positive rods. So I usually remind students, our in English, our in Tagalog means amin, in Bisaya, amua. So it's AM, amin, amua, it's ours. So the our rods is seen in AML. ALL, usually seen in the young age group, 2 to 6 years old. So you have a mean of about 4 to 5 years old. CML has the famous Philadelphia chromosome. Okay, Philadelphia chromosome. Now, can anyone tell me specifically what is the translocation? Which chromosome, okay, is the translocation for Philadelphia chromosome? Philadelphia chromosome. We know it's chromosome 22, but where is the translocation? It's 9 and 22. Okay, very good. Okay, it's T 9 22. Very good. Okay. I hope you got this. The translocation. So the Philadelphia chromosome is associated with CML, or chronic myelogenous leukemia. So please memorize that by heart. You should get something here which will come up in your boards. Okay. Now for manifestations, more or less they have the same manifestations. I just want to highlight that fatigue and bone pain can be the manifestation of ALL. There's now the lymphadenopathy and the hepatosplenomegaly. AML can present with the blueberry muffin. It can also present with gingival hyperplasia, and in severe cases, DIC. CML can present with splenomegaly. It can present with a blast crisis, so there's hyperuricemia on top of neurologic manifestations. Headache, change in sensorium, okay? So again, of ALL, amongst ALL, AML, CML, which is usually seen in children? Most commonly seen in children. ALL, AML, or CML? Okay, in children, young children, it is mostly ALL. Okay, which of them is associated with the Philadelphia chromosome? Again, which is associated with the Philadelphia chromosome? Okay, very good. Which is associated with the hour rods? Ano yung hour rods? Okay, it's AML. Now, question. What drug is notorious for causing gingival hyperplasia? What drug is notorious for causing gingival hyperplasia? What anti-epileptic drug? Okay. It is usually caused by phenytoin. Okay. Phenytoin is associated with gingival hyperplasia. Now, let's summarize what's in the morphology green boxes of Robbins. Okay. So, what disease is this? Hypercellular marrow with lymphoblasts. It's associated with Alzheimer's disease, and it's the most common malignancy in children. Okay, so that is acute lymphoblastic leukemia, commonly referred to as ALL. Okay, acute lymphoblastic leukemia, hypercellular marrow with the presence of lymphoblasts. Now, what about this? Hypercellular marrow with the presence of myeloblasts. And what you would encounter is the famous hour rods. Okay, what you will encounter is the famous hour rods. Okay, so please take note of this. So I hope this is clear. The next, characterized by the pathologist hypercellular marrow and the famous sea blue histiocytes. What is your diagnosis here? Sea blue histiocytes. Okay. This is chronic myoblastic leukemia or CML. Okay, sea blue histiocytes. Please take note of this. Okay. Hope this is clear. Sea blue histiocytes. Now, I just want to highlight another pathology pearl in Robbins. This is CLL or chronic lymphocytic leukemia. You can encounter smudge cells or smear cells, aside from the green box morphology telling us the presence of significant proliferation centers. Okay, proliferation centers. I hope this is clear. So I hope this is clear. Chronic lymphocytic leukemia. Now, I just want to add this. Okay. Hairy cell leukemia triad. Lumabas ito. This came out recently. So you have the presence of pancytopenia, splenomegaly, and the hairy cells. So what you see here, these are the hairy cells or the spikes. This is also associated with Epstein-Barr virus. Hairy cell leukemia. So I hope you got this. Pancytopenia, splenomegaly, and the hairy cells. Now, we're almost done. Let's mention the lymphomas. Hodgkin's, non-Hodgkin's, although majority of Hodgkin's, non-Hodgkin's will be in adults, it actually has a handful of paragraphs in Nelson's. So between the two, Non-Hodgkin's is associated with Burkitt's and the white race, but Burkitt's in many references is associated with African Americans. So a little confusion there. Hodgkin's, age group 15 to 19, it is associated more with the black race. And here's the Epstein-Barr virus. Now, it is impossible that Reed-Sternberg cell will not come out of the boards. Reed-Sternberg cell is the histologic hallmark of Hodgkin's disease, wherein you have prominent owl's eye appearance or the presence of mirror images. Okay, that is the classic. Okay, classic na classic yan. Now, there are 4 histologic types of Hodgkin's: lymphocytic depleted, lymphocytic predominant. We have the nodular sclerosing, then we have the mixed cellularity. Now, the one that is the most common is nodular sclerosing. That is the most common. The one with the worst prognosis is the lymphocyte depleted or the lymphocytic depleted. Non-Hodgkin's, on the other hand, it's either lymphoblastic, small non-cleave, that's where Burkitt's falls, and the large cell lymphoma, particularly the B cell or the mantle type lymphoma. B for big, that's the largest. M, mantle for malaki. Okay. So please take note of this. Now for diagnostics, okay, X-ray, CAT scan, staging. Okay, now the staging is different for Hodgkin's and non-Hodgkin's. This is what you should memorize. In Hodgkin's lymphoma, they use what we call the Ann Arbor classification. In non-Hodgkin's, what they use is the St. Jude classification. Now, assignment, post in your respective Telegram groups a photo of non-Hodgkin St. Jude staging and a photo of Ann Arbor staging. Okay, those two. So for the treatment, chemotherapy, okay, with multi-agents for both. Hodgkin's has a 90% cure rate, which is good, unlike Hodgkin's. Now, I want you to post in your assignments what is CHOP regimen, what is R-CHOP. Okay, this is commonly used for lymphomas. So I hope this is clear. Now let me mention this. Oh boy, this is a clear one. Obvious, no obvious, ito sa boards. The Reed-Sternberg cell. Okay, the owl's eye appearance. Okay. Now lastly, okay, we're going to mention 2 last cancers, osteosarcoma and we have Ewing sarcoma. I want everyone to take note of this. So for osteosarcoma, this affects all races, more common in males. It has the famous spindle cell, okay, osteoid. Usually affects the metaphysis, especially of the distal femur. Most common primary cancer of the bone in children, okay, is osteosarcoma. Most common. So please take note of that. Osteosarcoma. Okay. And this is osteosarcoma. Look at that. Usually presents with local pain, swelling, and at times history of trauma. Okay. So what do we call this pattern here? In the X-ray, what do we call this pattern? Which is pathognomonic of osteosarcoma. Okay, we call that the sunburst pattern. Okay, the sunburst pattern. Now, I want everyone to take note of that. So we have the famous sunburst pattern, which is a lytic lesion on the X-ray. Since the bone is involved, you'd expect a rise in the ALK phos as well as the LDH. Treatment is surgery and chemo. I think in a previous surgery exam, they asked where does osteosarcoma usually metastasize? The answer is the lung. So here we have the reaction of the bone, okay? Periosteal reaction. Here's the sunburst pattern. Then here is the Codman's triangle, okay? Since the bone is involved, the bone becomes elevated. And that is actually a sign of periostitis or a reactive bone, okay? So two X-ray findings for osteosarcoma. Okay, we have the Codman's triangle and we have the sunburst pattern. So please take note of this. Okay, so Ewing sarcoma. Look at this table from Nelson's. In Ewing's, okay, it's primarily whites. This is also the small round cell. And unlike osteosarcoma, which affects the metaphysis, Ewing's affects the diaphysis. And the periosteal reaction is not sunburst, but it's called the onion skinning. It's the onion skinning. So please take note of this. So as mentioned, lungs is usually the site of metastasis. So here, I want everyone to remember this, the onion skinning. That is very, very Ewing's. Okay? So let's end with this. What disease presents with the sunburst pattern and affects the metaphysis of the long bones? What's your answer? Okay, that's osteosarcoma. So what disease presents with the onion skinning pattern and affects the diaphysis of the long bones and is considered to be a small round cell bone tumor? Okay, this is now Ewing's sarcoma. Okay,